this does kick off Breast Cancer Awareness Month. So what is myth? What is reality when it comes to detecting the potentially deadly disease and treating it? We are back with Dr. Angela DeRosa with what every woman needs to know next. Hard to believe we've reached October 1st, but we're here, and that does mark the beginning of Breast Cancer Awareness Month. Every year, researchers do make great strides to both detect and treat this disease. But along the way, we can sometimes get misinformation, and that's why we have Dr. Angela DeRosa here to set us straight on some of these myths. Good morning to you.
Good morning.
We'll get to some of the myths in just a moment, but there's some new tests that you want to talk about.
Absolutely. When we look at breast cancer detection and prevention, the diagnostics have gotten really terrific this year. There's been a big push on 3D mammography, which can actually eliminate some of the previous problems with detecting cancers on 2D traditional mammography. But there's also a brand new blood test, which actually detects the presence of inflammatory and tumor marker cells in the blood, which can signal the presence of breast cancer. So it's a nice adjunct to mammography now.
When would we be able to get that blood test?
You can. It's actually for women between the ages of 35 and 50, but women also over the age of 50 if they have implants, history of abnormal mammograms in the past, fibrocystic breast disease, or a family history or a personal history of breast cancer.
Wow.
So it's really for most women, and we're starting to see cancers, especially breast cancers in younger women, and mammography is not necessarily always accurate in the women under the age of 50.
How fascinating.
So this blood test is a great complement. We're not suggesting to eliminate mammography, but if you put the two together, we bring the accuracy up almost to 100%.
And do we ask for that just at our physical or our annual?
We're very lucky here in Arizona because this test is not available across the country yet.
Yeah.
So if you talk to your doctors about that, they can certainly suggest ordering it for you if you're a proper candidate. If not, we can always call our office and we can give you recommendations for personally to get it drawn or find another physician like ourselves who can help you get it drawn.
That is great information. All right, let's go through some of the myths, okay?
Yes.
And then you're going to reveal the answer
yes,
as
absolutely.
we go along here. Okay, myth number one, breast cancer is the #1 killer of women.
That is absolutely false. We have spent a lot of time and energy on breast cancer in women, but the #1 killer is cardiovascular disease, heart attacks and strokes. So it's just a little unfortunate that we forget what is really killing us, and we've put all this attention on breast cancer, which I think is fabulous, but we need to keep an eye on the big picture too.
You bet, and then get, you know, regular exercise.
Absolutely.
And all of that. You touched on this, but let's go there anyway. Myth number two, mammograms pick up all cancers.
And they do not pick up all cancers. Unfortunately, certain cancers have to develop to a certain size before the mammography can traditionally pick it up. It is getting better that we can pick them up at much smaller sizes now with the 3D mammography, but 2D mammography still has limitations, and it may take an increase in size or enough calcifications to pick it up.
Which leads us into myth number three, that tumors are usually detected by a mammogram at the size of a grape. Is that?
Now they are not. It's actually, that is also false, because now they've gotten much better with the 3D mammography. We can pick them up at the size of a pencil tip head.
Wow.
So the eraser size. So that's not a bad size to be getting things, and that means we're catching things much, much earlier now.
Which is why fundraising is so important, and all the research is so important. So many strides here. All right, number four. Hormones cause breast cancer.
This is my favorite myth, because when hormones are done bioidentical and non-oral, meaning not by mouth, they are completely safe. Hormones do not cause breast cancer. In fact, it's interesting, when you even look at the worst possible hormone that was studied, the Premarin and Prem-Pro, it actually showed a decrease in breast cancer in the arm that was estrogen alone, which was interesting. Also, Prem-Pro showed a negative or neutral status, so it didn't increase breast cancer and it didn't decrease breast cancer. But bioidentical hormones by themselves have never been shown to cause breast cancer. It's a genetic mutation of a cell, or a mutation caused by inflammation, so smoking, being overweight, drinking too much alcohol, radiation exposures, other things that cause that cell to mutate will then cause the cancer. Wow. If it is an estrogen receptor cell, like a breast cancer, that will cause it to grow faster if we give estrogen, but it won't actually cause the cancer.
So important to listen to your body, that's for sure. And then myth number five, and here it is, breast cancer means no HRT.
So no hormone replacement therapy, and that is also false. Women who have had breast cancer and even undergoing current treatment for breast cancer, we can safely provide them testosterone therapy for women. And testosterone actually helps eliminate about 60 to 80% of all the menopause symptoms they're going to incur during that treatment for breast cancer. And testosterone actually lowers breast cancer risk. We used to use it to treat certain types of palliative breast cancers. It is very safe for women and actually lowers the reoccurrence.
All right, Dr. DeRosa, thank you so much. A friend of mine, her husband had some testosterone replacement therapy, and she says he has his sexy back. So it was fun to hear about that. That was after a segment that you did with us. I wanted to share that with you. Anyway, she said, life is so good. Anyway, appreciate that. I said, well, what was that conversation like with your husband? She says, I'm not even going to explain that part. Anyway, thank you. Always a pleasure to have you here.
You're welcome. Thank you.
Great.